Measuring the severity of a disease is a complex process that involves evaluating various factors, including clinical symptoms, laboratory results, and patient-reported outcomes. The severity of a disease can be measured using various methods, including clinical assessment. 1. Symptom severity. Evaluating the severity of symptoms, such as pain, fatigue, or difficulty breathing. 2. Physical examination. Assessing physical signs, such as swelling, redness, or abnormal sounds. 3. Laboratory tests. Evaluating laboratory results, such as blood tests, imaging studies, or biopsies. Disease-specific scoring systems. 1. Disease activity scores. Using scoring systems, such as the Disease Activity Score, DAS, for rheumatoid arthritis or the Expanded Disability Status Scale, EDSS, for multiple sclerosis. 2. Severity indices. Using indices, such as the Severity Index for psoriasis or the Eczema Area and Severity Index, EASI. Patient-reported outcomes. 1. Patient-reported symptom severity. Evaluating patient-reported symptoms, such as pain, fatigue, or difficulty sleeping. 2. Quality of life assessments. Assessing the impact of the disease on quality of life, such as the short form, SF-36 or the European Quality of Life 5 Dimensions, EQ5D. Other factors. 1. Comorbidities. Evaluating the presence of comorbid conditions, such as diabetes or hypertension. 2. Treatment response. Assessing the response to treatment, such as the effectiveness of medications or therapies. 3. Disease progression. Evaluating the rate of disease progression, such as the rate of tumor growth or the progression of disability. Examples of disease severity measurement. 1. Cancer staging. Using the TNM staging system to evaluate the severity of cancer. 2. Heart failure classification. Using the New York Heart Association, NYHA, classification system to evaluate the severity of heart failure. 3. Asthma severity assessment. Using the Global Initiative for Asthma, GINA, severity assessment tool to evaluate the severity of asthma. Conclusion. Measuring the severity of a disease is a complex process that involves evaluating various factors, including clinical symptoms, laboratory results, and patient-reported outcomes. Disease-specific scoring systems, patient-reported outcomes, and other factors can provide valuable information about the severity of a disease. Understanding the severity of a disease is essential for making informed decisions about treatment and management.